Good day, everyone. My name is Ahamad Nafizat Fehintola. I'm an intern pharmacist at the University of Ilorin Teaching Hospital, Pharmacy Department. I'm here today to talk on World Malaria Day. World Malaria Day is celebrated every 25th of April to bring global attention to the effort being made in the eradication of malaria and also to encourage the action to reduce suffering and death from the disease. It is also to highlight the need for continued investment and sustained political commitment in the eradication of malaria, prevention and control of malaria. It was instituted by the World Health Organization member states during the World Health Association in year 2007. This year, World Health Organization and partners will mark the World Malaria Day by celebrating the achievements of all countries that are approaching and achieving malaria elimination. They provide inspiration for all countries that are working to stamp out this deadly disease and to improve the health and livelihood of their population. Moving on, what is malaria? Malaria is a serious and sometimes fatal disease that is caused by parasites that are transmitted to people through the bite of an infected female Anopheles mosquito. Statistics have it that 97% of Nigerian population are at risk of malaria, of having malaria, and while the other 3% live in malaria-free islands. There are an estimated 100 million cases of malaria with over 300,000 deaths per year. Children aged 5 years are the most vulnerable groups of people affected, and in 2019, they accounted for 67% of all malaria deaths worldwide. Moving to the transmission, it is transmitted through the bite of an infected female Anopheles mosquito, which carries the Plasmodium parasite. When it bites, the parasite is released into the bloodstream, and once they are into the bloodstream, they go to the liver. They go to the liver where they mature for several days, and the mature parasite enters the bloodstream and begins to infect the red blood cell. This red blood cell, within 48 to 72 hours, it bursts, and when it bursts open, causing several symptoms, which occurs in cycles, which last for 2 to 3 days. The symptoms of malaria include fever, chills, general feeling of discomfort, body pain, cough, abdominal pain, diarrhea, nausea, and vomiting. Diagnosis of malaria. The clinical diagnosis of malaria is based on patient signs and symptoms and physical findings on examination. It is done by examining the patient's blood under the microscope to see if there are any malaria parasites. And the most commonly used diagnostic test is the rapid diagnostic test, which is based on immunochromatographic procedures. Treatment of malaria depends on diagnosis and physical examination. And early diagnosis and treatment of malaria helps to reduce the disease and the transmission. It also reduces malaria transmission, and it aims at eliminating malaria from the bloodstream. The World Health Organization recommends artemisinin combination therapy to treat uncomplicated malaria. And ACT rapidly reduces the concentration of Plasmodium parasites in the bloodstream. It also aids rapid resolution of clinical symptoms, and it is also effective against malaria drug-resistant Plasmodium falciparum. So practitioners often recommend the combination of ACT with a partner drug. The ACT helps to clear the parasite from the blood within 3 days, while the partner drugs helps to clear the remaining ones. So the World Health Organization recommendation include the artemether plus lumefantrine. We have artesunate plus amodiaquine, artesunate plus sulfadoxine pyrimethamine, amodiaquine plus sulfadoxine pyrimethamine, artesunate plus mefloquine, dihydroartemisinin plus piperacin. Moving to the prevention of malaria, vector control is the mainstay to prevent malaria, and the World Health Organization recommend the protection of all people that are at risk of malaria to use insecticide treated mosquito nets, the use of indoor residual spraying with insecticide, and the use of mosquito repellents, then also clearing of bushes or drainage of stagnated water. In conclusion, the theme for this year's World Malaria Day is Zero Malaria Starts With Me, and efforts are being made generously by the World Health Organization and countries to see to this. And efforts are being made generously to see to this, to see an end to this malaria pandemic. And the Zero Malaria starts with me and you. Together, we can achieve this. Thank you for listening.